Welcome to Partners Community Health Plan. For the next few minutes, we're going to talk about the health insurance plan that your employer has provided for you. Partners, as we call it, promotes use of high-quality local care and covers a wide range of services, more than most other health plans. We will talk about that and how to use the services, but before we start, and just so we're all on the same page, let's cover some basic health insurance information. In all health plans, there are all kinds of covered services. We call them benefits. For example, there is coverage for doctor's office visits, emergency room visits, hospital visits, medical supplies, and on and on. The list is long. Sometimes these benefits cost you nothing. The Partners Plan has many things that cost you nothing, more than most plans. Benefits provided at no cost to you are those that are intended to keep you healthy, like wellness checkups and tests. Other types of benefits cost you a small amount of money every time you use them, like $20 or $30. The cost is called a copay. An example of this is when you get the flu and go to your family doctor. The office visit charge costs you whatever your copay is. Some benefits have a deductible and a coinsurance percent that you pay up to your out-of-pocket limit. Your employer selected the amount of the deductible, coinsurance, and out-of-pocket limit. The deductible is an annual amount you pay for certain types of services before insurance kicks in. When you meet your deductible, the coinsurance amount is a percent of the cost for services that you are responsible for once your deductible is met. You only share in these costs until you reach what we call an out-of-pocket limit, although some plans have an unlimited out-of-pocket. This is a lot to remember, but don't worry. Some of this information is also on your health insurance ID card, and all is explained in detail on the Partners Benefit Summary, which you will find in your Partners Introductory Packet. This summary also features a glossary of health coverage and medical terms to help you better understand your benefits. Now let's talk about what makes Partners Community Health Plan different. The idea behind Partners is simple. By using doctors and hospitals close to your home, you get excellent health care while saving money. Let's say you need surgery, and you might think, well, I should go to a hospital in a big city, even if it's far away, because big cities mean big hospitals and bigger is always better. Or so you've been led to believe. But take a closer look at your local hospital, and you'll discover that the care you get is just as good, and it often costs you less out of your pocket. We call Partners a community health plan because you get lower costs when you use your local hospital, doctors, and other healthcare providers. Together, all these providers make up the Partners Home Network. So you may be saying, okay, I want great medical care at a low cost to me, and the lower, the better. But how do I go about it? Well, it's really very simple. Just take a look at the top right corner of your Partners ID card. There, you'll see the name of your home network. Or go to the Partners website at www.partnerschp.com. On the home page, click the Members Login. Then enter your username and password, and click on the link for your home network. Use the search feature to find a provider for the care you need, or to make sure that a doctor that you already use is in the home network. And should you find that, hey, the type of care I need isn't available from the home network, no problem. If you need care that can't be found locally, your plan has a backup network which features multiple healthcare providers that can deliver this care. Your backup network is also on the Partners website. Your local doctor may recommend a backup provider if one is needed. This is called a referral. But remember two things, and these are very important. Before you go to a backup provider, 1, make sure the provider is listed in your backup network, and 2, call Partners first for prior approval. The phone number is on the back of your ID card. If you get prior approval and the referral provider you use is in your backup network, then your Partners plan will pay the same or about the same amount for the care as from a home provider. Check your benefit summary for details. By the way, there's an important exception to the prior approval rule. If you need emergency care, go to the nearest hospital and Partners will pay the same amount for your care as it would for a home provider. Maybe it's popped in your head. Hold on. So what happens if I get care from a backup provider that I could have received from a home provider? Well, that's considered out-of-network care. And for that matter, so is any care that you don't get from a home or backup provider. In either case, Your partner's health plan will pay less for the care, and that means you pay more. Earlier, we told you that Partners provided more benefits than most other plans. For example, with Partners, you can get comprehensive eye and dental screenings from our networks of eye doctors and dentists. Partners also features a worksite wellness program that helps plan members take charge of their health, plus one-on-one coaching for such conditions as high blood pressure, asthma, and diabetes. As we've said, Partners Community Health Plan was created to give you excellent health care while saving you money. And the people behind Partners want to make sure that you get better care at a better cost. So, if you're thinking to yourself, but I've still got a couple of questions about my plan, please call MedBen Partners Customer Service. A customer service member will be happy to help you. Oh, and one more thing. Remember to stop by the Partners website. In addition to finding home and backup network providers, you can also learn about some of the other features of your plan, including discounts on health and fitness products and services from local businesses. Just point your web browser to www.partnerschp.com. And finally, thanks for being a Partners member.